If you're looking to lose weight after 40 years of age, you may be wondering what's the best way to go about it. There are several different factors to take into account, including genetic predisposition, stress, your thyroid glands, and your joints. Achy joints. As you age, you may start to experience aches and pains. These can be the first warning signs of an underlying problem. If you are experiencing joint pain, you should consult with your doctor. There are several treatments available that can relieve pain and help prevent further damage. Osteoarthritis, OA, is a disease that affects about 32.5 million adults in the U.S. Typically, it affects the knees and hips. It is caused by wear and tear on the joints. Inflammation is also a common symptom. Some factors that can contribute to joint pain include obesity, heavy physical labor, and injuries. You can also make changes to your diet and lifestyle to reduce the stress on your joints. The best way to maintain joint health is to exercise regularly. Exercise helps you maintain flexibility and mobility. It also strengthens muscles near your joints to reduce the risk of falling. Regular exercise can reduce pain and improve the flow of nutrients to your cartilage. You should also drink plenty of water. Water helps lubricate the synovial fluid that lubricates your joints. Keeping your joints well hydrated can help alleviate arthritis pain. Alcohol and sugary drinks can increase inflammation. Smoking also causes damage to your joints. Also, lack of sleep can worsen joint pain. If you are experiencing a sudden onset of joint pain or stiffness, you should see your doctor. A doctor can perform tests to diagnose the cause. They can also recommend alternative medication to treat the condition. Genetic predisposition to weight gain. The genetic predisposition to gain weight after 40 years of age is nothing if not a health risk. Fortunately, most people with a gene pool can do something about it. Taking the appropriate steps from smarter shopping to better nutrition can help. Those who do it right will reap the rewards. In addition to losing weight, you may find a better quality of life and perhaps a lower blood pressure to boot. So, if you're one of the many unlucky souls, do what you can to improve your odds of success. This might include a change in job or family situation, or a change in diet. Getting back in shape should be a priority, if you aren't already. Luckily, there are many resources to turn to. You just need to know where to look. A little research goes a long way. It's the key to a happy and healthy life. And it doesn't have to be expensive. There are lots of free resources online. Many of them are based in your city, so take a moment to check them out. Most are open to the public, so be sure to read the fine print carefully. Make sure to use the free resources wisely, and you'll be glad you did. Stress. Stress and weight loss after 40 is a multifaceted topic. The effects of stress can vary from person to person, but research shows that stress is related to weight gain and loss. There are several factors involved, including the availability of food, sleep, and other health-related issues. To lose weight after 40, it's important to maintain a balanced diet and exercise regularly. But the key is managing stress. The authors investigated the association between stress and weight gain in a nationally representative sample of U.S. adults over a 9-year period. They found that, overall, psychosocial stress was associated with more weight gain. However, the link between psychosocial stress and weight gain is different for men and women. In the male group, the association between psychosocial stress and weight gain was more pronounced than in the female cohort. For example, men with higher baseline body mass indexes exhibited more weight gain when exposed to work stress. Women, on the other hand, showed greater weight gain when exposed to depression and generalized anxiety. The relationship between psychosocial stress and weight gain may have implications for workplace interventions to reduce psychosocial stress. One of the many reasons why losing weight after age 40 is difficult is that the body changes as people age. For example, the metabolism slows down after the mid-30s. This is a consequence of a combination of muscle loss, a decrease in metabolism, and a shift in the metabolism from fat burning to energy production. Thyroid glands. Thyroid glands control several vital functions in the body. These include heart rate, metabolism, and muscle control. Its ability to produce hormones decreases as you get older. Having an overactive thyroid gland, hyperthyroidism, can increase the risk of cardiovascular problems. However, it is treatable. The symptoms of an overactive thyroid gland can vary from person to person. Some patients can experience constant fatigue and tremors. Others may have joint pain, diarrhea, and sweating. A thyroid function test can be performed to check the health of the gland. If the test results show that the gland is underactive, treatment can be started. There are many causes of thyroid disorders. One common cause is a lack of iodine. As you age, the gland's ability to uptake iodine diminishes. Women are more likely to have thyroid diseases than men. This is especially true after menopause. Also, women are more susceptible to thyroid conditions that occur during pregnancy. Symptoms of an overactive thyroid gland can include swelling in the joints, a fast heartbeat, frequent diarrhea, and constant hunger. They can be caused by a number of reasons, including viral or bacterial infections, autoimmune disorders, and medication. In order to prevent thyroid disease, it is important to maintain an adequate intake of calories and nutrients. Eating a balanced diet of protein, carbohydrates, and fats is a good way to keep your blood sugar and calorie levels balanced. Omega-3 fatty acids. If you're 40 or older and want to lose weight, then omega-3 fatty acids might be for you. There's plenty of research about the potential benefits of the fatty acids, and it's also true that many of the studies have been mixed. Although studies vary, one study found that higher levels of EPA and DHA were associated with a lower risk of coronary artery disease. It's also true that a high intake of fatty fish was associated with a reduced risk of colorectal cancer. Moreover, the benefits of omega-3s may extend to infant health. A systematic review examining the effects of dietary supplementation with EPA and DHA on cardiovascular disease and diabetes showed that these supplements can reduce the risks of heart failure and stroke. The National Health and Nutrition Examination Survey, NAHNS, measures the levels of omega-3 fatty acids in the United States. According to the data, males consume an average of 1.55 grams and females 2.32 grams per day. But the best way to figure out if you are getting enough of the omega-3 fatty acids is to check your erythrocyte fatty acid analysis. You can also measure the levels of individual omega-3s in the serum. Those containing ALA and EPA make up a small percentage of total omega-3 intakes. Studies also show that dietary fiber can help reduce estrogen concentrations in the bloodstream. This helps to keep hot flashes at bay. Keeping a consistent eating schedule. Keeping a consistent eating schedule is essential to a successful over 40 weight loss program. The key is to have a well-balanced diet and regular exercise. Many 40-somethings don't have much time to spare and may have many other obligations. One of the best ways to keep a consistent eating schedule is to get enough sleep. You'll be less hungry and less likely to overeat. Other factors to consider are the quality of your sleep and whether you are stressed out or not. Stress can increase the number of calories you consume. As you get older, you'll also experience changes in your hormones. These include a decline in estrogen production in women and a decrease in testosterone in men. These can affect your weight gain. Some research suggests that the best way to lose belly fat is to do a moderate amount of physical activity on a regular basis. This can include walking or light yard work. While you're at it, you should also pay attention to the health benefits of eating foods rich in calcium. Calcium will help strengthen bones and reduce the risk of fractures. It's also important to get plenty of vitamin D. Finally, don't forget to take the time to learn more about the latest diet and fitness trends. Using a tracking device such as a fitness tracker can help you keep up with your exercise regime.